Hello, I am Dr. Hemant Antani. I am consultant physician practicing for the last 30 years in Anand. I am having my own private practice and my special interest is non-invasive cardiology and diabetology. I am also attached to Zydus Hospital, the tertiary hospital in Anand, and visiting consultant, and I handle my critical patients there. Heart disease is very much on rampant today. So we are seeing that so many patients are increasing, and if you just want to look at the statistics, according to one statistics, about 20 million people in the world die because of the heart disease. And it is said that by 2020, 120 million patients will be suffering from the heart disease. But what I am seeing in my clinical practice, which is more dangerous, is that we are seeing more and more young patients who are coming as a heart patient. And that is something for which we have to be really careful about. If you look at India, the statistics says that out of 1,000 people, 127 men and about 45 women, they suffer from the heart disease. As you know that when the patient is stuck with the heart disease, the outcomes are catastrophic. But in spite of this bad news, the good news is that the heart diseases are preventable. So if you have to understand what exactly causes the heart attack and how it can be prevented, the most important thing would be to have a look at the risk factors, why this heart disease is happening in the patients. There are several risk factors. The time doesn't permit, but we'll have a very quick view of all the risk factors which will make you understand the importance of each risk factor. We see that today tobacco is rampant in India. It's not just smoking, but I think tobacco chewing, which is singular identity of our country. And it is said that 80% increase in the heart disease happens if the patient is consuming the tobacco. And we find that more and more people, in fact the young people, are getting involved in the consumption of tobacco, which is very dangerous. But the good news is that if you give up the tobacco, at the end of the 1 year, your risk would be reduced by almost 50%. So if you are into tobacco, chewing or smoking, this is the time to wake up and give up your tobacco. You must have heard a lot about cholesterols, which people talk about. It's written in the newspapers all over. And you know about HDL cholesterol, which is considered to be a good cholesterol, LDL cholesterol, which is considered to be a bad cholesterol. So cholesterol definitely plays a very important role in causation of heart disease. How it happens? It's a woolly substance, and in your heart arteries which supply the heart, they actually cause the block. Initially it gives you angina, which is a chest pain. And when it gives you 100% blockade with the rupture of that plaque, which will give you a heart attack. And that's the time when the person becomes very serious. So it's very important that you should keep your cholesterols under control. It is said that if you reduce your LDL cholesterol by just 1%, the risk of heart attack goes down by 2%. Now this is a very important statistics, and you should understand that you must make all the efforts to control your cholesterol if they are high. Another thing, it's almost an epidemic in our country, and in fact all over the world, is obesity. As you know that obesity is measured by what we call it as a bone BMI, and BMI is basically measured by a calculation. We'll not go into the details of that. You can contact your doctor to have your BMI done, but it should be less than 25. If it is more than 25, then definitely you are overweight. And if your BMI is very high, then you can go into what we call as extreme obesity, and the time has come that you should really give a lot of importance to that. Obesity comes with a lot of problems. Of many problems, the heart disease is one of the problems which is very commonly associated with obesity. And that's why it's very important that you have to lose your weight. And there are data which shows that if you lose your weight, that the chances of developing heart disease definitely goes down. Another very important risk factor we see very commonly these days is blood pressure. Now, we many times hear about the blood pressure being age plus 100. This is all gone, and that is not correct. At any given time, if you have a blood pressure of 130/80, which is ideal, but we allow up to the 140/90. Now, there is an entity which is called as a pre-hypertension, and I think I should draw your attention to that. If your systolic blood pressure is between 120 and 139, and if your diastolic pressure is between 80 and 89, then you are a patient of pre-hypertension. You don't need treatment, but this is an alarm that you must start developing a good lifestyle modification, and if you can bring down your blood pressure, then you can be saved from a lot of catastrophic heart disease which can ensue. So It is said that if your blood pressure comes under control, the risk of heart attack goes down by almost 20 to 30%. Now, this is a very significant statement, significant data that is available from studying so many patients. So you must control your blood pressure. Another thing, and now we know that India has become the world capital of diabetes, and we see every other person diabetes. Either we see or you see in your family and all around that people are having diabetes with very high frequency. Now, diabetes in our language is considered to be heart equivalent or heart disease equivalent. What it means is that diabetes has a very high risk of giving you a very serious heart problem. The problem with diabetes is that the heart problem also goes almost 3 to 4 fold in a patient who is having diabetes versus the patient who does not have diabetes. But many diabetic patients do not have any chest pain, and that makes it a very complicated matter. And that's why ideally all the diabetes patients must have a thorough check for their cardiac status, and that's very important. So you must bring down your blood diabetes and keep it under control. If you are diabetic, what we call it as a HbA1c, which is a very sensitive marker of diabetes indication, it must be less than 7%. And this is very important, but if you can control your diabetes, then you don't have very high chance of developing heart disease. To me, one of the most important risk factor today is stress. In fact, you find in my practice, and I'm sure so many of my colleagues also would perhaps agree with me, that we see patients less than 30 coming with massive heart attack very often. In fact, we are seeing them with more and more frequency, and I would even not hesitate to say that the average age of getting heart attack is really going down. And one of the reasons is stress. So, well, it's a big topic, but then you have to know how to handle your stress. Stress is always going to be there, but you have to make sure that how you handle your stress, and stress should not overcome you, so much so that it can give you the heart problem. At this juncture, I also want to clarify one thing, that when we say heart disease, it does not mean always heart attack. But in a general term, when we say heart disease, we always mean heart attack. The heart has got so many other problems like valvular problems and pericardial problems, but what really matters to a common person is a heart disease. There are certain other risk factors which are not under your control is age. And as the age advances, the cholesterol, the atherosclerosis happens, and that's why you can develop the heart problem. If you have got heredity, in the sense that the heredity is defined as if you have anybody in your family, this straight one, either father or mother, who has died before the age of 50 because of heart attack, is considered to be a positive hereditary history. If somebody has died at the age of 70, is not considered to be a positive hereditary history. So friends, you have to consider all these risk factors. If you are having any one of them, you have to make sure that you have to get rid of them. So what would be my tip as a very senior cardiologist physician to you? Well, you have to listen to your body. The human life is given only once. It's all up to you, and I always say that we initially squander our wealth. In fact, squander our health to begin with, to gain the wealth. And after we have gained the wealth, we squander our wealth to again gain the health, which doesn't happen. So it's very important that you take care of yourself, the human life, which is so precious. You must have a very healthy lifestyle. Every day morning you must walk. If you cannot go to the gym, not necessary. Even walking 45 minutes, 5 days a week is also good enough for you. You must get into the healthy lifestyle as far as the food consumption is concerned. You must keep away from extremely spicy and oily food. Not that you can't eat, but there has to be moderation in everything that you do. And if your blood pressure is there, you must keep it under control. If you're diabetic, it must be kept under control. You have to find out some way to control your stress, or whatever way you want to do. And the most important thing, and I really want to stress this point here again and again, is the importance of getting health checkup done regularly. Maybe 10 years back, I might have said that if you're crossed 45, you should do it. But today, I would like to say that everybody who is 35 and above must get their body checked up every year. And we do what we call as a treadmill stress test, which is very simple test. But from that, we can really unearth the underlying heart disease, in which we make you do an exercise on a treadmill and the cardiograms are taken. And from that, we can find out whether you are a candidate for heart disease or not. Depending upon your risk factors, your doctor will tell you either every 2 years, every 3 years, or every year. But you make sure that you have your treadmill done, and that's a very, very sensitive test as far as unearthing ischemic heart disease is concerned. So friends, do not neglect your body, live healthily, and I'm sure that you can definitely conquer your heart disease. Ultimately, I always believe key to healthy heart is only in your hands. Thank you very much.